Hi, I'm Nitya Balaji, speech and swallowing therapist from Sarvodaya Hospital and Research Center. So today I'm going to talk about speech and language development in children with cochlear implant. Did you know that cochlear implant can improve speech and language development in children who have hard of hearing? Before knowing that, we need to know what is speech and language development. So speech and language development is a process by which a children can learn sounds, words and sentences in order to communicate effectively. So it involves different kinds of skills like listening, understanding, producing sounds and constructing the meaningful words and using those language in a different social situations. So this speech and language development begins in babies like infancy, starting with cooing and babbling. Then they will start using their first words and progresses to starting their word utterances. Then they will develop their larger vocabulary as they grow. So this process of speech and language development may look little different with respect to the children with hard of hearing. This especially true, hence earlier a child receives a cochlear implant, the better chances for developing the speech and language skills as they grow. So it is very important to understand the early implantation is very important to develop their speech and language skills. So early days of post-implantation, majorly they will focus on their awareness of sound, basic vocalization and producing basic vowels. Then they will reach their babbling stage. So this stage is delayed, but later on they will progress to attain more complex sounds and then the syllables. Then they will start using their one-word utterances. Often this will start little later when compared to the typically developing children. With practice and then with therapy, they will match according to their age-matched peers. Then they will start using their phrases and sentences with improved articulation. So in order to achieve this, a child with cochlear implant should attend auditory verbal therapy and speech therapy. So these therapies basically focus on improving their auditory skills, producing the sound and language comprehension. So basically they will emphasize on listening and verbal communication rather than relying on the sign language or the other forms of communication. Despite of attending this auditory verbal therapy and speech therapy, the child with cochlear implant outcomes will or may vary among children depending on the factors like age at which the implantation has done or presence of other comorbid conditions or the support and the amount of therapy they have received. Some children may experience a few challenges like delay in speech and language development, difficulty in producing certain speech sounds or limited vocabularies and other grammatical errors. While other children or some children may experience near normal language outcomes. Hence, a consistent use of the device, daily practice, attending speech therapies or auditory verbal therapy and encouragement from the families can give a significant improvement in the child's speech and language development. I hope this video is informative. Thank you for watching.